Hi, everybody. I'm Dr. Glenn Hammock, founder of Medicine at Work.
And I'm Dr. Mark Ahern, Medical Director of Medicine at Work.
And we're here today to talk about sun protection and how it can lead to cancer prevention.
Our goals today are to help you to understand the effects of UV rays on the skin and identify risk factors for sun damage and skin cancer and identify ways to reduce the risk. We're going to start out with a little quiz and we'll go over the answers later on. First question is, if you use plenty of sunscreen, you can stay in the sun as long as you'd like. True or false? Next question, which of the following surfaces reflects ultraviolet rays? Snow, sand, ice, water, or all of the above? Next question, you don't need to protect your or cover your skin on cloudy days. True or false? Next question, wearing white during hot weather protects you from sun damage because light-colored clothing reflects light rather than absorbing it. True or false? Choose a sunscreen with a sun protection factor of at least 5, 10, 15, or 30. Darker lenses on sunglasses offer better protection from ultraviolet rays than do lighter colored sunglasses. True or false? Sunbathing or suntanning once in a while won't hurt your skin. True or false? The darker your skin color, the less you need to worry about sun protection. True or false? You shouldn't use sunscreen and insect repellent together. True or false? So, how can you control the risk from ultraviolet radiation? Of the sunlight that reaches the Earth, 5% is ultraviolet, and there are 3 different spectrums within that ultraviolet portion. All the ultraviolet radiation reflects off water, snow, sand, and ice. Although all ultraviolet rays damage the skin, ultraviolet B does not penetrate as deeply and is more what is responsible for the typical sunburn, while UVA will penetrate deeper into the skin and damages the elasticity of the skin and is more responsible for skin cancer. UVA penetrates more deeply into the skin, and a good way to remember between A and B is that the A in UVA stands for aging, but also causes skin cancer. It's not blocked by window glass. It will penetrate light clothing, penetrates more deeply into the skin, and has more long-term effects than UVB. Good way to remember UVB and its effects is the B stands for burn. Cloud cover will provide some protection, and the intensity of it varies with the time of day, the season, the altitude, and the weather. UVC is more dangerous than A and B, but most of it is absorbed by the Earth's atmosphere. it causes more serious damage to DNA. How does UV radiation affect the skin? The most common and acute response is sunburn. More long-term effects are photoaging. It's the leading cause of skin aging, and the damage begins as early as in one's 20s. Skin cancer. Ultraviolet radiation is a known carcinogen, and the effect is cumulative. The more time spent unprotected in the sun over your lifetime, the greater the risks. How your skin reacts to ultraviolet exposure depends on your skin type or skin color, and ranges from always burns and never tans to never burns and tans deeply. Skin cancer is the most common form of cancer in the U.S., with about 1 million new cases diagnosed yearly. 1 in 5 Americans and 1 in 3 Caucasians will develop skin cancer in their lifetime. 90% of all skin cancers are caused by sun exposure. If a person has had 5 or more sunburns in their lifetime, their risk of skin cancer doubles. Here are a few pictures of the common types of skin cancers. So if someone has a family history of skin cancer and has never seen a dermatologist, that's reason enough to see one about any lesions on the skin. Other reasons would be for moles that change in size or color, are multicolored, or that bleed. The sun protection factor, or SPF, was developed by the FDA to describe the level of sun protection provided by sunscreens. An SPF of 30 allows an individual to stay out in the sun 30 times as long as without a sunscreen before developing the same reddening of the skin. The different levels of SPF block a large percentage of the UV radiation, but the American Association of Dermatology and the Skin Cancer Foundation recommend a minimum SPF of 15. It's important to remember that they need to be reapplied every 2 hours, even on a cloudy day, and especially after swimming or sweating. Sunscreen recommendations are to use a broad spectrum, providing protection from both UVA and UVB, to apply it 30 minutes before sun exposure, and reapply it every 2 hours. Also needs to be reapplied immediately after swimming, toweling off, or excess sweating, and it's recommended to use 1 ounce each time. Tanning beds are sometimes looked at as an alternative to being out in the sun, but tanning beds can emit UV radiation in doses 15 times that of the sun. Occasional use of tanning beds almost triples the chance of developing melanoma, and a single use of tanning beds before the age of 35 increases the risk of melanoma by 75%. People who use tanning beds are 2.5 times more likely to develop squamous cell skin cancer and 1.5 times more likely to develop basal cell cancer. On an average day, more than 1 million people in the U.S. tan in tanning salons. 70% of them are Caucasian women ages 16 to 49. So let's go over our test questions. Number one, if you use plenty of sunscreen, you can stay in the sun as long as you'd like. This is false, although the sunscreens will delay the effects of UV radiation. They don't stop them entirely. Number two, which of the following surfaces reflects ultraviolet rays? All of the above. Number three, you don't need to cover your skin on cloudy days. This is false. Number four, wearing white during hot weather protects you from sun damage because light-colored clothing reflects light rather than absorbing it. This is false. Number five, choose a sunscreen with a sun protection factor of at least 15. Number six, darker lenses on sunglasses offer better protection from ultraviolet rays than do lighter colored sunglasses. This is false. Number seven, sunbathing or suntanning once in a while won't hurt your skin. This is also false. The effects are cumulative. Number eight, the darker your skin color, the less you need to worry about sun protection. This is kind of true, but all skin colors are subject to the effects of UV radiation and increased risk of skin cancer. But the lighter your skin color, the more the risk. Number nine, you shouldn't use sunscreen and insect repellent together. This is also false. Might make you smell a little funny, but both can be used safely together. Last question. How can you control the risk from ultraviolet radiation? Now you know. Tell your friends and family.
Thank you, Dr. Ahern. That was very helpful. This is Dr. Hammock now with a couple of concluding comments. Sun damage is something that we've all had a little bit of exposure to, like the picture in the lower left corner. Hopefully we've not had anything as bad as the picture in the upper right side of this slide, where we've got a gentleman peeling badly off his back. Obviously this is the kind of exposure you'd want to avoid. A question we frequently get as doctors is, why is there such an increase in skin cancer? And there's an element of relationship to our trends in fashion and lifestyle, where as we go back to the age of our grandparents and perhaps a little further back, the 1890s, Victorian times, the trend was to have an ivory complexion, stay covered up and avoid the sun, as these ladies are exhibiting here in this photo. This avoidance of the sun has persisted in contemporary times in other cultures, as you see here, where a lot of folks in the Pacific Rim area take sun protection very seriously. Perhaps a little more popular today are rash guards, which are designed to be used in the water and protect from both abrasions of the skin and do a great job of protecting from the sun as well, and are quite a bit more stylish than what we've seen so far. Our sun-worshipping lifestyle probably came to its peak in the 70s and 80s, and I think nobody exhibited a better prototype of this than J.R. George Hamilton, the actor, who was very tanned his entire life and even ended up as the crispy colonel in advertising. He was known for having had a lot of skin surgeries to remove potential cancers. I don't think this is a model to emulate anymore. How you apply sunscreen can be important to how effective it is. Not that you have to go to the lengths of the gentleman with the roller, however he's getting very good coverage. Usually using sprays and spraying it into your hand and wiping it on is more effective than just trying to spray it on, where most of it ends up in the air. On behalf of Dr. Ahern and myself, I want to thank you for your attention during this presentation. And we want to close with what we think is an excellent video about sunscreen and its effects. So click on the link below and enjoy. It's a very, very powerful message.